What's good, y'all? It's your boy Herb.
And it's your girl Mo.
And welcome to our
soon-to-be world-renowned podcast, Young, Black, and Figuring It Out.
What up, though?
What it do?
Whatever, retailer. How you feeling?
Wonderful.
Yeah, you loving this wintertime?
I didn't say that.
Yeah,
but I'm feeling wonderful.
You wonderful anyway.
Yeah.
I feel y'all. It's okay, y'all. We just trying to make it. It's all type of stuff happening this season. Windstorms and snow, and it's early. But it's okay. We going to make it. The Lord will provide, as they say. Now, listen, we are super excited to be here. We got an amazing topic, one that we know folks are always looking forward to.
Yes.
You know, being black in white spaces. And this is about how to navigate racism and diversity in the mental health, especially the therapy space, which you know is a space that you're passionate about.
Yes, very much so.
And, typically, we start off with the what did you figure out this week? But we ain't got time for that this week.
Ain't nobody got time for that.
Well, we ain't got time for that.
Because we have a wonderful, special, amazing guest.
All that?
Yes, Dr. Kenya Malcolm.
Clap it up for Dr. Kenya.
Let's keep expectations low. And please call me Kenya.
Appreciate that.
Will do, Kenya. Thank you.
Yeah, so thank you for being on the show. Again, we are so excited to have you, knowing that we're going to get all the knowledge and wisdom. And I know you said keep the expectations low, but we know it's going to be amazing. The gems and the jewels. We can't
drop
wait.
them.
Yeah, okay, and I guess the context around this particular series is a lot of the times folks, especially as they ascend in professional spaces, end up having to navigate spaces that are predominantly white, right?
Right.
And so we know that comes with a host of things that go way back to structural issues up into just interpersonal issues. And so we like to talk about all these different spaces where as black folks, we kind of got to navigate these spaces that are predominantly white. So we wanted to pick you all's brain as the experts and the gurus today. How does that happen, especially in the space of being a black therapist, you know, or being black mental health providers in that way. So we're just going to go through some questions, have some dialogue, kick it, and I think folks really like to learn from you two. So can we start?
Yeah.
Feeling
I'm
good?
ready.
Feeling good? So can you talk, maybe just tell us about yourself and the work that you do.
All right. I work here locally in Rochester. I'm a clinical psychologist. I've been at, is it okay to say where we work?
Yeah.
Okay.
You
I
should
have
share
to
all your
buzz it
business
out
if you
later.
want.
You can give out all the businesses, addresses, it'll be everything up in here.
All right. I work at the University of Rochester Medical Center. So right now, about half of my time is at an outpatient mental health clinic, child and adolescent, and then about the other part of my time is devoted to primary care. So we have behavioral health clinicians where children get their regular doctor's visits. And most of my work right now is focused on infants and early childhood and their families in the mental health space. So helping people really across like teachers, pediatricians, other clinicians learn how to and get support while they're providing care to the littlest kids who need help.
I love that. And is that that for that second part you mentioned that's in primary care, is that like the behavioral health is like integrated into the primary care?
Exactly. So we have offices, and that's actually where I know Mo from. So if you take your child to their doctor's visit and you have concerns about, let's say they're not speaking on time or your potty training, like if it's a little kid, or they keep getting kicked out of school because their learning isn't on target, or there's been a major loss in the family, like a divorce or a death, or you're in one of the neighborhoods that has a lot of neighborhood violence in Rochester, you might bring that up in your PCP visit. And then we have behavioral health people who are on site and have some flexibility in their time so that they can meet with you while you're there. And then you can also have follow-up time with them on their schedule.
Oh my goodness. Can I just ask if that is good? Can I just ask you too? I know. It's like, look at you, like, all script already. No, but no, that's just so good. And I guess thinking about like some of the traumas that, families can experience, especially black and brown families, the way like systemic poverty and, violence has like kind of like sprung up in our neighborhoods. Like how like important is that having it to where it's not just like the physical health,
Right.
but also like the mental health, and like and how I guess related are those two things, like people's physical health connected back to like the mental health,
Like, I mean, because I work on that floor and I took Kenny's office. Thank you, by the way.
Yes, Mo stole my office.
I did. I surely did. But I have loved the way that doctors and us always work together, or providers of any sort, because sometimes you'll have patients come in who are like feeling all these stomach aches and avoiding school and all these things. And they're like, we think it might be anxiety. And then they're like, can I get a behavioral health clinician to come in? And we start working together, treating this one child from multiple angles, right? And sometimes they call for us, but there are a lot of times we call for them as well, because I've had kids get sick in my office. I had kids have all kinds of things going on, and like medication issues sometimes, and the ability to just call up the doctor real quick or hit them up and they come through and we work together as a team has been phenomenal. Did I answer your question? Because now I'm like, what'd you ask?
Oh, yeah, that's good. Yeah.
I'm good at forgetting questions.
No, that's good how politicians do it. They like take the question and answer what they want to answer. But no, but you answered the question though. It was like, how does that connect back? Like, how does that relationship between like the physical or like people would see as like a physical space for like we go to the doctor to like the mental and behavioral health. I don't know if you wanted to add to like how you see that connection.
Yeah, I absolutely agree with everything that she said, and I think that the other piece. Because sometimes kids come in and people are calling it just behavior, or it's just this, or it's just that. And then we get in there and get an opportunity to talk about, actually, we think it's anxiety, or we think it's learning. Because as medicine becomes more and more specialized, each person gets more and more, we think about silos, so there's a group of people who work on your heart, and there's a group of people that work on your lungs, and there's a group of people that work on your feet, but if you're not walking well and you're not breathing well, your behavior is probably not going to be the best either. So it's all really tied together. Or if you got a kid who's real fidgety and it turns out they've got eczema, so it's important to think about the whole person, because I know I don't act the same if I'm real tired, or if I'm hungry, or if it's too hot, right? So making sure that the team really thinks about that whole person and what's going on in the family and all of that stuff.
Man, that's so good. Got me fired up in here. Yeah, okay, yeah, love that. Good. All right, well, thank y'all for indulging me from just going all over the place.
That's okay.
So, okay. So, just thinking about this idea of, and I think this term gets thrown around, but maybe I can even break this down because this is one of my areas of expertise in this, the idea of cultural competence. And like, even taking that idea of competence, you hear like humility and sensitivity, all those things, but like, how do people engage? Because a lot of the times I think what we might see, especially in areas where, again, think about systemic poverty and racism and whatnot, that you might see providers taking care of folks or clinicians taking care of folks who don't look like them. And specifically, you might have white folks taking care of folks who are black and brown, who might not understand all of the cultural things that go to somebody's like mental health conditions or even physical conditions in that, right? So what are some of the ways that you've seen or experiences that you had where you're like helping to help people understand like cultural humility or cultural competence and how to apply that in like the care they're providing?
I find that there are a lot of one-on-one conversations that I typically will have when sometimes in frustration, like colleagues can share things about like, this is really bothering me and da-da-da. And sometimes you can like insert those moments of, well, based off of like historically or systematically, like these are some of the things that they're dealing with. Or even sometimes like jumping the gun on a diagnosis. And you're like, pretty sure this is trauma. And it's like coming out this way, and trying to like give those kind of moments to like pause or break it down a little slower happens a lot. I will say the push is to make things more not universal, in like our area, that this is something that's common. Like we're doing regular professional developments and getting our CEUs on cultural competency, especially since we service majority black and brown. But it's, I think it's a day-to-day fight, if I want to be honest.
Yeah, I think that's true. I think medicine, whether it's physical medicine or any of the towers, the ivory towers that we live in or that serve us or whatever, I think there's an assumption, not just an assumption, but purposeful and systematic giving of power. So the further up you go, it's almost like the things you know are more important than what other people know. And really what you need to do is make sure that the people you're working with, that you're just giving them the just tell them what to do and they should just be doing it, So I think part of what's come out of the move towards being more culturally competent, more culturally humble, is a recognition that their way isn't the only way. And that is really across the wide range of diversity, right? Like, even if you just think about the use of interpreter services, for example, that when we have someone who needs an interpreter, it's really about who prefers another language to get their best care. It's not about making sure that we can understand people because they don't speak English, right? Like their ability to talk to us and communicate with us and our ability to communicate with them effectively should be in a language that is comfortable for them because they're receiving care. We need to make sure they're giving informed consent. That's the same thing, the interpretation needs of folks who come from different cultural backgrounds, so there's lots of stuff on the internet, like patients being referred to psychiatric consultation because they're doing this to their hair, because the doctor doesn't understand that that's one way they're helping to relieve some overdue.
Like patting our heads. When it's itchy.
Or some of the ways that we might use English, feels different, or like a symptom of something if you don't understand where they're coming from. Or people who within their families, and I'm from the South, my family grew up in Louisiana, and we talk about, a breeze is my grandma coming through to say hello. If you're in some context, that's going to get you a referral. So really recognizing that people come with their whole person, and that their whole person not only should be allowed, but should be expected to have a space in their medical care.
Yeah, I 100% love that. And I love how you frame like the idea of the language piece. It's not that like it's because they're deficient.
Right.
Right? Is that something wrong for them to speak a different language? Is that we need to have the resources in place to be able to get them the best care possible.
Right.
Yeah, no, that's good. And the example for folks who might be listening to, I saw that case study where there was a woman who was she was an inpatient in the hospital, and she had been patting her head, and it's like, hey, listen, y'all, the weave, I gotta get this together.
It's itchy.
And the folks, again, that cultural competence or humility didn't understand that, hey, this person's head is itching, right? Oh man, they're like hitting themselves, they're harming themselves, and actually got put to their inpatient like behavioral health unit, right? And so it's like, oh wow, and like, just like if that's somebody who would have been there who knew. You understand? Because like, oh no, that's not well, they should be. If they weren't doing it, I think something was wrong. Like, you know what I'm saying?
Right.
Yeah. It's funny actually how often hair comes up, and especially for Black care. Looking at the research on Black women in particular who will avoid certain physical activities or like swimming as an option because of their hair. Right. So it's been interesting to see people recognize the importance of that, but that only goes so far because we have been trained sort of on purpose, I'll say that again, with intention to not talk about it. Because if we don't talk about it, then they can go on having the power that they have, and we can go on being uncared for in the way that we've always been uncared for, right? So even to bring up something that feels race related feels racist or racialized on purpose. So they can't even ask the question without feeling like they're going to be accused of something. And we can't be asked the question without feeling like we're being accused of something. And that's part of the system that keeps things going. I heard you guys talking before about, how we get stuck because of comfort.
Yes.
Right.
And that definitely applies to the relationship that people have with their health provider.
Yeah.
Right.
I just won't talk about it.
Yeah.
Because language is so important, like y'all were saying earlier. And like there's cases of people saying, like answering in a way that concerned the medical provider. Because they say, yeah, fam. And they're like, ooh, thinks I'm part of their family.
No,
it's like,
good gravy.
Things like that. When it's like, it's so simple to us because that's just so normal to say. But someone who has no context and isn't really doing the work to understand the context, it's harming.
It is. And that's why, and this question came up, we went to a conference not too long ago, and it was about Black women's mental health as a result of the unjust killings of black men, and not just police shooting, even though that's a heavy one,
right?
It's a heavy burden on the community, but other ways in general, right? And one of the things I was thinking about is like, man, we need to have like these conversations were great, and I thought about our podcast that we're talking about today, and I thought, that burden on black women is tough. But then I thought this, and this is where like the flip side of like we need more providers of color into our spaces, is that hearing the things that folks might hear. I know you are like licensed professionals, right, to do this, but absorbing that from our community, as much as there's definitely like a separation between like this is the work and if you can set it down and go home, it's better for your own like personal emotions. But like, does that ever get hard though? You know what I mean? When it's like, hey, this is our community going through these things. Like, is that heavy to carry, or have you been able to find a way to navigate that to where it doesn't impact you as much, or is it an and/or?
That's a great question. I think it depends. Honestly, there are times when almost like you become numb to it because you've heard it so much, or you've been here so long, or you've been doing the work so long. That's like, yes, like I know it happens, so I'm here with you. But then there's times when it touches so close to home, and you feel almost too connected now to this person because like we share trauma. I am in this with you. I am fighting for you now. And sometimes I find myself wanting to like champion for them because no one did it for me, And that is, it's hard. And I'm good at holding in my emotions, but Lord knows you say something and I'm naturally triggered now. Like I'm just crying. I'm just sad. Oh gosh, what?
and no, I'm like, and I wanted to, and also to be clear for like the audience, it's like, it's different when we think about the space of like clinical care, but specifically like mental health for like people thinking of like therapists, right? People like in any type of like psych space or therapist space, like you're getting like a lot.
Yeah.
Like you're getting,
especially if they're comfortable.
You're getting the depths of the depths.
They
I'm
tell
like,
you
that's
everything.
Gotta be difficult, So
yeah,
just curious, like that has to be hard.
Yeah,
right?
Especially when then they start seeing you more like a family member too. So now they're really like they're telling you the nitty gritty type of energy, and it's like now you're auntie, so help me, and then you feel this like heavy responsibility to help them. Yeah, so it's not easy every day. I ain't gonna say.
Yeah, I think it definitely varies. I also think, one of the interesting pieces of it is, we're kind of talking about being Black in predominantly white spaces. And to get where we are now, we've probably navigated predominantly white spaces before, right? Like this isn't our first predominantly white space. So some of the walls and the calluses, and all those things are things that we've built up over time. It's not like we've been plunked down.
Right.
So I think that's something, when we think about young people who are being bused into predominantly white school districts, and the lack of support we have for that, it's traumatizing, but also educational, and I hate to have that, like, well, you're so good at it because you were mistreated. But there is a little bit of element to that, right? And this having to figure out when to fight versus when to not fight, when to assimilate, when to keep your head down, when to just get that degree. People will say that all the time, like, don't worry about, the foolishness, just get that degree and then you can do whatever you need to do. So I think that those things come to mind when you ask that question, as well as, as Mo was talking this idea too. So here's me as the therapist, right? And then here's the patients who look more of them look like me, right? And then here's the people I work with as a team. Most of them look different, right? So then when they've got the foolishness, and everybody's got foolishness, so I don't mean to say, to say everybody's got
but specific types of
foolishness.
Right,
specific kinds of foolishness, right?
Yeah.
So we've got this foolishness that's happening, and then the people they're having the foolishness about look like me, right? So like I've had to navigate diminishing sometimes some of my identities, right, in order to fit and to succeed and get all of that stuff. And then, like I remember Patty, who I don't think that she would mind me telling this story, saying something about a young Black girl who came in and her hair was a mess. And Patty, who's a white nurse, said something about this Black girl's hair was a mess. And I looked at her. Patty and I are friends, right? Part of the same team. And I go, oh. And she goes, oh. I was like, you know, and she recounted something. She was telling that story to me like later on when she said something like, I remember one time you were saying something to me. I was saying something about this black girl's hair, and you said something to me. I was like, oh, okay, we don't do that. And I was like, and I love that you picked it up without us having to, have a whole thing about, but why? And, all of that sort of stuff that we do have to hold space for their foolishness sometimes, legitimately, because they're learning, right?
Right.
And they learn something new, and I'm talking about white people specifically, learn something, or somebody from a different cultural background, they learn something new, and it opens their eyes in a way that is unbelievable. And so then they have to check in with everybody they know to make sure that that person's not making it up. You know what I mean?
Yes.
Yep.
Which means all the other people also have to hold space for the foolishness.
Yes.
So that's part of that sort of navigation piece that feels like that makes patients who are black and brown feel more comfortable when they walk in and there's a black or brown person, because they feel like they don't have to navigate that in the same way.
Right.
Exactly.
But you don't know. What I always say is like, not all skin folk are kinfolk, right? You don't know if that's a day that person's fully assimilated with the white majority, or if they're full of the same foolishness because they've had to grow up navigating the same space everybody else had to navigate.
Yeah, they're like, I'm gonna fully compromise to this. I'm not even fighting it no more.
Exactly.
It's like, whatever I gotta do.
All y'all must be, what I mean?
Clarence Thomas it out. But I got you.
Exactly. Because I had a black family who was very suspicious of the medical care, which makes total sense with our history, right? 100%. And then I had a black clinician who was like, oh, well, they just sound paranoid. And I was like, let me give you some readings upon the medical apartheid.
Right.
My land.
My land. And you're like, oh, now I got a whole space for your foolishness, and I didn't have the spoons for that this week.
My goodness.
So I think that navigation piece is long. It's not just like each thing, which it also is. It's also the system, the development,
everything,
the patients,
the entire context,
right? All of that. And we're never going to have the number of, we're only 14% of the entire population. Right. So this idea that we're going to solve those problems, the problem we didn't create for ourselves, is completely ridiculous. So we have to be able to hold space for the foolishness.
Absolutely.
Which means we also have to be able to have spaces where we can let it go.
Yeah, 100%. And the word that's coming up in my mind that you all have to navigate, and that folks who have to navigate predominantly white spaces in general, but especially in this space where it's like you're holding so much for other people. And a lot of it is our people. It's the word resiliency. Like you have to be so resilient, and that's so difficult. Like when I think about that idea, because sometimes the idea of resiliency for me is like weaponized to be like, oh, you just gotta be resilient. You gotta fight through it. It's like,
it's fine if you don't eat this week. You're resilient.
Yeah. Oh my goodness.
Exactly
so like that, I that's the word that came to mind, because it's like it is that thing is what almost you have to be, but it's like it's negative. It's not a good thing, right? And that's why I use the word. It's like I don't use it in a way of like you're so resilient. It's like, dang, we have to be,
right?
And we shouldn't have to be in that space, It's like, man, I have to be here to. You said hold the food, and I love that. It's like you said all the time, the foolishness right here
on a regular.
But then I also have to have enough in the tank, enough capacity and space to go and be here and be present for somebody who's not just sharing their story. And this is what I try to share, like when you're in a collectivist community culture, that story you're sharing isn't an individual story. It's also my story now.
Right.
I'm seeing me and you and vice versa. Like that's a lot of weight. And so I appreciate what you are doing. Up in there. That's a lot. Which goes to like my next thought in there is, what is in place and what's like the plan, like to care for the people who are giving the care?
That's a great question.
Like what are you doing for yourselves and for other black therapists out there, like those folks? Because we have to have a good amount of those who listen to our podcast. Like what do you do for yourself, and what should folks be looking to do for themselves as the people who are caring for the people?
I don't know if I have an answer. I'm here like just think about this week. I'm like, I struggled. And like, can you put it into context for me where I'm like, that is probably what drained me so much, because it's like it feels like you're fighting daily, but you don't even notice you're fighting daily because of all the foolishness, right? Like I feel like I'm combating. So part of me is like, I was so drained, I didn't know how to self-care. I was like, the most I could pull off was doing my dishes washing my hair just so I felt better and my space felt better. Like that was the most I accomplished to get myself like oriented back. You know what I mean?
Seems like a lot to me.
Well, I think
It was a push. A whole thing.
It was a push. I was like, Lord, I don't want to do this, but I did it. It was rough. I don't know. Kenny, you got some ideas? Like, how do we help ourselves and each other?
Yeah, I mean, I think, and I'm a rebel, an oppositional peer sometimes, because I think one of the things, and I just posted on Facebook about this the other day. I don't even remember what the meme was or whatever, but my comment was, if it had been up to me, we'd still be banned from the counter because I can't handle people pulling my hair. You know what I mean? So like sometimes when people are like, how are we going to fix it? I'm like, why do I have to fix it? You know what I mean? Like, because I think part of the privilege we don't have is to just be mediocre and to just look out for ourselves and to just, it's just us by ourselves. You know what I mean? Right. We have to be for the people, and then when we mess up, it looks bad on everybody, but when we do good, it's an exception, all of this stuff happens because of being marginalized that is exhausting. Yeah. So I think first we have to be willing to recognize that we are allowed to look out for what is in our best interests, right? Because I know a lot of nurses especially, who stay in completely toxic environments because they want to help the patients, because they don't want to leave the patients without. And it's noble. I don't know where the nobility is going to get anybody. You're thinking about all the teachers who are staying in classrooms because there's nobody else. And my thing is, when we make it work, it tells the system it's working. Yeah. Right. So if we hold it up, and and like I said, that doesn't make me popular all the time because I'm telling people fairly often I'm not doing it. Because if you can't do it, it can't be done. You know what I mean? Right. Like I can do what I can do, and then I'm going to go home. Right.
Strong boundaries. She has amazing boundaries.
I can't do it. Right.
I love it.
Yes.
If I say I'm going to do it, I'll get it done. But I'm not going to automatically, the metaphor I like to use for my clinicians, especially in primary care, is this piece of paper that because we're behavioral health in a primary care space, they want to come over and hand us things all the time. Here's a patient I don't know what to do with. You take it. I don't know how to handle trauma. You take it. And that our job isn't to automatically just take the paper. It's to look at the paper together. And I think that that's part of how healing and part of connection happens, is that we don't see ourselves as sort of the savior of a situation, but that we can slow down and bring the collective together to collaboratively problem solve, because I can't hold it all. I won't hold it all. Sometimes it's gonna fall, and we're gonna have to self-care, but also heal when it falls. But the system isn't made for us, and we have to be aware of that, and just always check ourselves. It's because sometimes, again, some weeks we're going to be out on the front line. We're going to be marching because we got to march, right? Yeah. Again, I'm going to send water bottles. I'm not good at the marching part, but like there's different ways to be helpful. I'm a donator helper. You know what I mean? I'm not really a get hit with the rubber bullets helper. We need those helpers too.
Yeah.
True. But you are an example.
When I think about the Hunger Games, I'm the person who's dropping the baskets for people in the woods. But I'm definitely at the Capitol, is what I'm saying.
I like that.
Inadvertently, you are a model for it.
You gotta know where you.
It's like that silent rebellion is really a good testament for people who are watching. It's like, you know what? Yes, that's the type of strategy I also need, because sometimes people will just keep giving you and giving you and giving you. And I learned in the last place that I worked, where it was toxic as ever, if you question it, they stop. Because you can't just say yes. I will not be your yes woman.
But you also have to be able to manage your guilt, right?
Yeah.
Because when you say no, they're going to go to the next person who's going to say yes, right? They're going to find who the yes people are.
Yeah.
And so they're going to stop asking you, but you're going to see your teammates
Suffering.
Yeah. Right. And so you're going to have to figure out how you're going to manage that, how you're going to help support them. I noticed that you keep saying yes to this. I wonder if that's really what we want to be doing.
Yeah. But you know what, though? So that is so good. Let me just say that. Because really what it is like,
Right for me.
no, it's like, that is permission to be like, because really, truthfully, I'm going way back. It's like the fight to, like when we stopped fighting to be our own, because here's the best answer, and I say this all the time, like the true story of every single black person in America said, you know what, we're going to get together and let's restart what we started to see happen in like the 20s to 1920s, which is we'll have our own hospitals and schools and buses and planes. And we all just did that and like, okay, cool. Then we can come to the table as equals to say, we have all the resources. What we asking for is not really an ask. We say, like, here's what we need. But if you want to do it, we don't need you.
That's right.
But the fight to integrate set us up to where we always had to fight.
Yes.
Because like the fight to integrate isn't like a here and a stop. You're continually in the system that you're fighting to do that. So what happens is you get into a space and you always got to fight because you're fighting to be able to be in the space. And it's something you all were saying is like, but if I drop into the space as somebody who's in the majority, who's in the dominant culture, I could just be there. I ain't got to be fighting for nothing. It's just what it is. But it's like I'm doing my job and I'm fighting to be able to be like.
My presence is the fight.
Yes.
Listen.
Some weeks the fight is bigger,
Yeah.
right?
Yeah.
Sometimes the fight is I'm going to get a document changed so that it's more inclusive, or I'm going to start a program, or whatever the thing is. But
Yeah.
it doesn't always have to be that. It
That's
can't
real.
always be that. And it's funny that you mentioned the integration thing because I was the integration thing, because somebody, I think I was reading it on maybe a Black Geek Facebook or something, and it was talking about how now that we have more diverse and inclusive sitcom kind of TV shows, we've lost those Black TV shows that were about Black family. Now we have like Black characters and other BIPOC kind of characters that are within friend groups and that sort of stuff, but things like Family Matters and
Fresh Prince.
And The Cosby Show and A Different World and all that stuff. It was about Black people, so you could see all these different kinds of Black people relating to each other. Because it was in response to someone, there was this Black nerd, and somebody said, oh, it looks like you must have gotten adopted by a good white family. And it was like, because there aren't as many of those examples that Black people come in all different kinds of Black people.
Right.
And we all interact with each other.
Right.
And it's not like if you're a nerdy Black person, you're just around all the white people. There are nerdy Black people in the Black spaces
Yes.
too.
Right.
So it's really interesting to think about how the word diversity and what diversity means and what inclusion means has changed over time. And as we've been fighting for these certain kinds of things, it also means that we've probably lost some things
Other
too.
things in
That's a
that.
good point.
Yeah, no, that's
Man, that hurts my heart.
What? So going back to like the idea of being like a therapist, right? If you're going to like navigating that space, are there? Well, first let me just ask this. I think I might know the answer, but the answer might still be: were there in like the training curriculum and like, the education and schooling, like were there like Black or like culturally representative examples, materials, experiences that were in that as you were learning that prepared you to be how to navigate those things? Or are you primarily bringing like what you've learned in school and then combining it with your lived experience to be able to do that,
That's a good question.
That question definitely triggered me. I'm not going to lie to you. Honestly, because in my first graduate program, I was one of 3 Black people, and I was the only Black woman. And we had to take a cultural competence class, and I remember the groans from all of my white counterparts, just mad because we had to talk about this. And then we did like certain exercises to show what privilege looked like. And I mean, the groans. I mean, people were complaining and then looked at me and said, I'm sorry, I'm white. And I'm like,
me too.
Do you expect me, you expect me to feel sorry for you? And you're mad at this one class that's like as honest as ever. We went around telling examples of like how we're treated in professional spaces because we're Black. And the 2 Black men that I was in school with, they were like, yeah, everybody thought I was like the gym teacher or the janitor. That's all. And I'm like, Yeah, but no, it was this lack of care or understanding. And I remember all the materials we'd get. It was teaching white people to work with Black people or people of color. And I asked many times, I don't know why I felt the need, like I had to speak up because I was just frustrated. I was like, where's the material for me to work with white people? I don't know anything about white people. I'm from Brooklyn. I was born and bred with nothing but Black and brown people. The most white people I had were teachers, and I had some experiences. So like, and they look at me like, that's a good question, Monique, but they had nothing for us. So I feel like a lot of the material we learned was very much.
It was all the other stuff, Mo. Besides that class.
It was like we learned about like how to do this work, but I felt like a lot of the samples and the visuals and the theories were all very white based.
White centric.
Right? Very white centric. And I think the latter of what you asked is really what I do, bring in my own experience and all the work, of working with children and life and bringing it together as much as possible.
It seems like, because I supervise a lot of trainees, and I am in the psychology space, and there are other kinds of disciplines. It does seem like there's been some changes, and I guess I've been out of grad school for about 15 years, and at that time, we did have a cultural class, I think at least one. I also took a couple of classes in like the sociology, like different disciplines are doing different things. Anthropology, you can go to different departments and get different awareness of things. It seemed, at least at that time, the majority, and I would probably say most of the continuing education now, is more about, here's the data on Asian Americans, or here's the data on a particular thing, right, for Asian Americans or for Black people or for, whatever. And I think that can be a great place to start. Again, it starts with this awareness piece. Maybe not everybody experiences depression in the same way. Maybe the symptoms look a little bit different depending on whether or not you experience this way or that way, or society treats you this way, or your identity or whatever. But that's only one thing. So even if somebody takes a lot of classes that talk about collectivism versus individualistic societies, or talk about how for adolescents it's irritability versus sadness, or that different parenting styles are more common in Asian cultures versus white cultures. It's only the place to start that somebody's story is different from what you know. You know what I mean? So you still have to be willing to hear that person's experience and recognize it within the context of the human experience, right? So I think for myself, coming into graduate school, having a different experience than a lot of my peers could only help because when you're hearing about a story and it doesn't sound like yours, you have to be able to say, okay, is that because my story was messed up? Is their story messed up? And I think that we people who come into training with a different experience are in the unique place of not accepting things as they're handed to you. Like if everything I heard in graduate school jived with everything I'd ever experienced, how would I have handled the one person who tells me something different the first time I meet them for a session? You know what I mean? So I don't think there's anything that we can learn only through books. I think Booksmart can only get you so far. And I certainly don't think that anything we're learning from books helps people feel prepared for a human being in the seat across from you. Right? And I think that that's, like we were talking earlier, if a thought, feeling, or behavior comes up, and we've already in our head biased that one particular thing as meaning this or this, and we can't put what they're telling us in the context of the story, then we're doing a disservice. They could look exactly like me, right? And if all I understand is what, Earl Baum 1995 said, right, I'm gonna miss it.
Right.
You know, and that happens a lot for new clinicians because they're trying to fit things into the boxes that school told them that it was gonna fit in. And people don't fit into the boxes.
People are way more dynamic than that.
Exactly. And they're not gonna come in and tell you the list of things for you to for you to do the box.
Right.
You know what I mean? They're gonna come in and they're gonna be like, this is my life.
Right.
And then you're going to have to sort through that. You're going to have to sit with them. You're going to have to match that on with the understanding you have about whether it's depression, anxiety, ADD, whatever the thing is, right? And how that fits or doesn't fit. How that doesn't fit in a way they thought it fit, because, you know, families come in and they have an idea about what's wrong with their kids, from they're possessed by a demon to they were exposed to heroin when they were in utero, to their daddy was just the same way when he was 3. Like they got all the stories for you, right? And if you can't hold space for them to tell you the story, you've lost them. Right? Like if you can't hear them, if they can't feel heard and seen, no other thing you do is going to make any difference. They're going to walk out and go, they weren't listening to me. That's the one, you know, patients say that all the time about medical care. I was complaining for years and nobody was listening to me.
People might be hearing what you're saying, but they're not really listening.
Not at all.
Not connecting. Yeah, that's good. Okay, so I know we're getting close. I got 2 more questions though. Add up in there. Okay. Hey,
Someone will just have to edit out the extra stuff.
Hey, so you know what though? This hit me. This is completely random and off the cuff, but I thought about this as we all were talking. I'm like, yo, okay, let me give you a scenario and tell me how you feel like this will actually go. You're so interested.
I never know. I never know.
No, I think, okay.
Excellent.
Okay, so if we were we're talking about being black and white spaces, right? But what if this was reversed? So let's say that we built up primary care with integrated clinical behavioral health, CIB, clinically integrated behavioral health, something like that.
Sounds right to me.
Whatever it is. Okay.
It's made up, so it doesn't matter.
Yeah, okay, well, whatever it might be. So that's an example. That's what we're going to call it for this story, right? We built that up, and the people within that context, so people who like ran the facility, so all the folks who are like in the admins, the VPs of like clinical care and all the good things, and the clinicians, all of the folks were all black.
Okay.
Right? And came through like similar cultures and what we might have experienced, right? We're in that situation. What do you think will be different in the way care is delivered?
Interesting.
Right? Like, let's say, and the client base is the same. I know you all see many different types of clients, but like, what do you think would actually be different in the way care is delivered? And the reason why I asked that is this. I sat in on a conference the other day. His name is Dr. Nichols. I forgot his last name. But he talked about this idea of how when you get away from like European cultures and get more into things that are like black centric. So like, and now because of chattel slavery, like all over the place. But you get to like Central Africa, and it's just all cultures are different. One of the things that matters the most is like relationship versus like transaction. You know what I'm saying? And he did like some research around that. He was going in depth. It was actually really cool. And I thought like, how would those things change the way we deliver care then? Like, what would be different, you know?
So I'm curious about your answer.
Really?
Yes. But I do also want to put it in a context, right?
Yeah.
Because we've got these levels of what we're talking about.
Yeah.
And so if we think about the individual and then think about the individual's family and then think about like schools, doctors, whatever. Yeah. Because we also have the country, and, you know, like it's bigger, it's bigger, right?
100%.
And a lot of, you know, and I think there's 10, it might be 12 elements of white supremacy, right? Yeah. That like the transactional nature of interactions and that kind of stuff. A lot of the things that are happening in medicine or in schools or in the justice system or whatever, they are happening in response to the bigger thing, 100%, right? 100%. So like lots of docs would really like to spend more time with their patients, but they have a 15-minute slot.
Right.
You know what I mean?
Right.
So if in the situation, in the utopian doctor's office that you're talking about, it would also have to be separated out from, it would have to be like plucked from all this other stuff.
From capitalism, that's all the way around.
Like it would have to be
all
plucked
the
from
things.
all this other stuff.
Right.
And the docs would have had to have been trained outside of that system. And we would have had to come from some, you know what I mean? Like, it would have to be Wakanda.
Oh,
You're getting at what I was getting at. Yes. Thank you.
Right? Like,
yes. And I'll come back to it, but keep going. Because you're getting at where my question is going.
right. Like,
yes.
like, because, you know, when you think about this the racism problem, right?
Yeah.
We think about it's in the groundwater.
yes.
Right.
You know, if that's the metaphor we want to use, or we could use the metaphor of it is the water in which our tea bags are steeped.
Right.
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 We're all experiencing it.
Right.
Whether your theory is that BIPOC people can't be racist because whatever, which is the older kind of way to think about it, or like if it's more of the Ibram Zandy, you know who I'm talking about, who talks about like we can all be racist because the definition is we are behaving in ways that maintain the racist system, right? If our behavior keeps the disparity, it's a racist behavior, and we're all guilty of that, and that just has to be true because we're in a system that's intentionally set up to maintain a power structure in which we are at the bottom.
Right.
Yes.
But what's your answer?
I mean, she killed it. So now I'm like, yes, in this utopia where there's no capitalism. And
right. And
What
so
she said.
like some of the stuff would work itself out because we've removed it from all that stuff.
right, without
Right.
those pressures.
Right.
External pressures. Yeah.
Right.
Right.
And probably the needs would be lower because we've met all those other needs. Like, we're not
Right.
going to behavioral health ourselves out of poverty.
No.
Right.
You know what I mean?
Right. 100%.
I like this
Yes.
Wakanda life. It sounded nice. I mean,
Right.
honestly, the most I could think of was the level of joy and the level of time spent with patients.
Yeah.
Because we are so relational, and I don't think we stick to time well. I'm not saying CP, but CP. We don't do time
Yeah.
as clear and cut. So I was like, oh yeah, you probably spent like way too long with patients and like really building this rapport and, you know, families and like, but I also think the level of like random, you know, cultural connectedness. So the way people speak and you hear them in the hallways and like maybe the music and
Yeah.
just the way the energy would feel.
Yeah.
You know, it would be a vibe on a regular, on a good day
Yeah.
maybe.
And there are clinics that try and do that. You know, or like I think Sankofa is a clinic that
Shout
it's
out
all
to Sankofa. Again, not a sponsor.
you know, we're all the sorry, not a sponsor. You know, where all the clinicians do share at least similar background or similar goals or
Yeah.
things like that.
Yeah.
They still get, you know, you still gotta do your notes, and you still got to see the next patient. You still got, you know, so all those things are still true. But the vibe would be different.
Yeah.
And some of that holding foolishness would feel different.
Yes.
Yeah.
Right. And we would feel like when we're holding the foolishness, we're holding it to the benefit of all of us. Because I think part of why that can be so hard is sometimes we feel like we're holding it because we can't do anything else.
Yeah.
We just got to hold it until we can walk out the door.
Yeah.
All right.
Yeah.
No, it's fine.
Yeah.
Right.
Yep.
No. Oh, you didn't know about
Yeah.
that. Oh, okay.
Yeah.
And then, you know,
Yeah.
walk away.
100% agree. 100% agree.
She know.
No, I think my answer when I was thinking about this was like it's twofold, and I just thought about this question in this context now, but I think about kind of how that might exist. Is one, I think the experience within the context in which we must exist would be better, right? Like the experience for us on a regular basis, because now you say you holding foolishness, but it's like, okay, it's a little bit different than when it's like, this is foolishness that I'm holding for the benefit
Of all of us.
right? And so
Right.
that's very different. Where it's like, oh, this is just regular. Okay, my man's Jay acting crazy because Jay just acting crazy.
Right.
Jay ain't acting crazy because like, was that because I'm black that he said
Right.
that?
Exactly.
It's that double consciousness you gotta exist.
Exactly.
It's like,
Yes.
it's because I speak. Can I speak with an accent that he acting
Right.
like that? You just know. Like,
Also, there's
that's
less
just
of
Jay.
the like, if I say something, now I'm that angry black woman again.
Yes.
Right.
You know, like, why do I always have to be the one to say something about it?
Right. The
Like
experience
that
is
part. Yeah, the experience of it is different.
which changes the way you feel. And in some cases, like the research shows, and this blew my mind. They came out with a PubMed journal, I think it was, that was that communities that have black physicians, just black physicians in the community, have better health outcomes for black people.
That makes
than
sense.
Just being in the community, not that they're necessarily practicing, not that, just the community being there, like that blew my mind, because it's like, yeah, you got people in here who are there, but one, there's so many things that go into that.
Yeah, I was about to say, I'm going to have to see what they controlled for, because where are the black physicians living?
Yeah,
right.
Because if it's Pittsford, you know what I mean?
A little different. But, so when you think about like, okay, all of those things, like how that impacts health and wellness, like that'd be great. But also, I thought about what you were saying, which is even if we redid all the structures, because things are existing within this greater context of
outside our control,
capitalism, racism, sexism, for all the things, that it still would have those things attached to it, which is why I think there was such a vehement response when we did try to have our own things, right? And things got bombed or taken away or intentionally destroyed because it started to go against the way that the structure set up in America traditionally run.
Yeah.
Which is to keep us down, right?
Right.
But,
absolutely. And to maintain a belief of entitlement that we aren't afforded, right? Like, who told them that they could have that?
Right.
When I don't have it.
Right.
Not equal, not better.
I appreciate that going with my scenario right there.
Yeah.
Okay. Right.
And we came up with Wakanda.
Wakanda forever.
We did.
I'm with it.
Can we just stay in this green room forever? Walk, what's happening? Okay. All right. So, all right, last question, then we can like wrap up here. And this is going back to like the black mental health professionals. You know, we like to leave like a gem for folks to for folks to think about.
No pressure, no pressure.
No pressure. Like I said, you don't always got to be the one to save them.
Like, you're just wise. That's all.
So what advice do you all have for like aspiring or just starting out like black mental health professionals or therapists in particular that are like navigating the field, right? As they're coming into it, what are some things that you like look back and say, hey, this is a part of the lesson that I would teach. It may not apply perfectly to your experience, but here are some general things that I would give for someone to think about. What would that be?
You know, it was not a mistake because, you know, you learn from your mistakes, but I should have connected more with people who were doing this work and who looked like me, especially when I was starting out. It's like to know what's coming, to have a deeper understanding, to like get some wisdom and like some support when you're going through things, because I worked in spaces where it was just me as the only mental health provider, and people above me had no education or understanding on that field, but were the ones controlling what I did. And it was a very difficult way to work when like your voice did not matter. It didn't matter your opinions, how you saw it. It was like you are a tool to be used. And so had I connected with people who did this work or had understanding, not only would it have grown me in a different way, but I would have been able to advocate better for my students, my patients, my peoples, you know?
Yeah, I mean, the word that comes to mind for me is mentorship. And I think we need each other. We need connection. And I think that in some systems there's already supervision, or there's like maybe a faculty mentor or something like that. But, you know, I took this course that was talking about how there are different kinds of mentors, and we should find those people and have intentional conversations about how you want to have a regular check-in with that person, or like what your goals are around your professional development, as opposed to these informal ways that we do it, or we don't do it at all, or we assume that any one person can be all the things that we need them to be, and then we don't think about where those gaps are, where those things are that we aren't getting. Right. So I think that definitely comes to mind, and, you know, finding ways to have those folks. I think it can also be hard when I first moved here. I was talking with a member of the community. Her name's Takia Graham, and she does some mentorship and some things around Rochester. But she's a black professor at MCC, and I was applying there, and she was in a different department, and they asked her to talk me into getting the job, right? So we all understand the scenario as it was happening, right?
Yeah.
And like one of the things that she told me was, being a black person, especially like a faculty, and as the further up you go, the hungrier the people you're working with are going to be for your time. right? So like if you're the only Black teacher that all of the Black kids have, they're going to gravitate towards you. You know, if you're the only therapist in a space, and I found this to be true, then they're going to want to give you all the Black people, right? All the Black people are going to say, I would prefer a Black therapist. You're going to get them all, right? And they're going to be hungry for this connection that they're missing. And I think that was probably one of those early times where I was like, I've got to protect myself too.
Right.
You know? So I think that those conversations around what it's like to navigate the space is really important, and to have Black-only spaces, which I think is a thing that we just don't, we don't want to ask for it. Yeah. We think it's weird. Yeah. People get real, iffy when we ask about it.
They over there plotting.
Exactly. We don't have white-only spaces. Right. I beg to differ.
Right. All the spaces are white.
Right. Yeah. In fact, if I hadn't walked in here, this space, so all of those kinds of things are real important. And again, getting comfortable with our own discomfort to ask for what we need, and the guilt that comes along with that, and that because we have an uncomfortable feeling doesn't mean that we're not making the right choices for our own health.
Amen. Listen, that was so good. I appreciate y'all dropping that. It sounds like connection. Both of you had a similar thread too, like connection to those folks who may have been able to do it, and like learning those things early. And I love it. You said it earlier too, and what you just said now about that idea of like managing our own guilt. Because that's such a real thing, right?
Right. Because if we are saying you needed to connect to someone, it means there needs to be somebody up here to connect to. Right. Which means we can't always say no.
Right.
Yeah.
But we have to manage how many times we say yes.
Yeah, I love that. That's good. Listen, y'all, this has been fire. Usually I try to like sneak in the end, but listen, I'm going to let people know. We about to wrap up, and that was so good. I'm going to let y'all know. This is probably like more. We're going to have to come back with another one of this because this was good. Yeah, this was like, I know we talking about like being Black and white spaces as therapists, but this is like a mini therapy session for me.
Oh, I'm glad.
Yeah, it's good.
She's dope, right? I told
Send me the bill, y'all. It's okay. But nah, this is fine. So listen, people might be listening thinking like, what in the world is he talking about? Listen, you might be right.
We might be wrong.
But at the end of the day,
we just young, black and figuring it out.
CC on the track, boy.